Shut the door for privacy. I would wash my hands. Hello, my name is Kira and I'm from Rose State College. I'm here to do your trach suctioning today. I would take my physician's order and my TAR and I would compare it with her armband and I would match her name and her date of birth. So name and date of birth, they both match so we can continue. And so then I'm going to look for her allergies and I'll make sure she's not allergic to any of the supplies I'm using. And so that's good. And so I'm going to organize my supplies. And so I'm going to, that's my hand sanitizer, my trach kit, my trach, my sterile solution, and my trash can. So after that, I'm going to compare my physician's order and my TAR, and I would make sure that it is time for her tracheostomy to be cleaned or suctioned. So check and make sure it's okay, it's both okay, so we can continue. So then after that, I'm going to check for my patient's, I'm going to assess my patient's respiratory status. So I'm going to check the rate, rhythm, depth, lung sounds, and O2 saturation. And after that, I'm going to gather more supplies. I'm going to get a PPE, a mask, goggle gowns, and a glove, some gloves. And I don't have gloves, so later on I'll just pretend I'm putting them on. So then after that, I'm going to do my check of my sterile solution. So my dose is however much is needed, the route is trach, the time is now, the reason is to moisten my catheter, the individual is Miss Smith, the bed is the normal sterile saline, expiration date is 12/0/21. And I would also make sure that it has not been open for longer than 24 hours. So then I will do it again. Dose is however much is needed, time is now, route is trach, the reason is to moisten my catheter, individual is Miss Smith, med is normal sterile saline. And then again, dose however much is needed, route trach, time now, reason to moisten my catheter, individual Miss Smith, med is the normal sterile saline. So I'm gonna set that back over here. So then after that, I would prepare my patient. So I would put a towel or a waterproof pad over their chest to prevent water from getting over them or any secretions that may come up from getting all over. And so after that, I will check my suction to make sure it's working properly. So I would put on a clean, regular pair of gloves, and then I would turn on the trach suction, and then I would, if it was connected to the wall, for an adult it would be 100 to 120 millimeters mercury, and if it was a portable, it'd be 10 to 15 centimeters mercury. So make sure that it's working properly. Then after that, I would turn it off, and then I would throw my gloves in the trash can. So after that, I would apply PPE because it's not already applied. So I would apply PPE. And so then after that, I'm going to open my sterile kit. So then I'm going to open it. And then using my 1-inch border, grab my glove, stick them to the side. And then now I'm going to lip my solution in the trash. And then I'm going to pour some in there to moisten my catheter. And so after that, I'm going to put on my sterile gloves. So then, I'm going to use my non-dominant hand and grab, step back, and place my glove on using the inside of my cuff. Going to grab, step back, and work my way down, and then I can adjust. Alright, so now after that, I'm going to grab my catheter, and then I'm going to use my non-dominant hand because it's still sterile to wrap this around. So I wrapped it around, and now after that, I'm going to use my non-dominant hand, it's still sterile, take this and connect it to my suctioning. making sure that this, and now that this hand is clean, it connects. So then after that, I'm going to check to see if it's suctioning right. So I would put my thumb over the port to make sure it's suctioning right. So now that this hand is clean and this hand is still sterile, I would re-moisten this if needed, and it's still pretty moistened, so I'm not going to. So then after that, I would hyperventilate my patient. I can hyperventilate them by using the bag, and I can pump a couple breaths into them and the 3 to 6 deep breaths, or I can have my patient take 3 to 6 deep breaths themselves, or I could also use the self-mechanical hyperventilation on the suction ventilation. So then after that, I'm going to stretch this out, and I'm going to put this into my trach. So I'm going to put this in 6 to 8 inches, or until my patient coughs or I feel resistance. And then I would make sure that I'm not covering the port. And then after that, I'm going to do intermittent suctioning. So I'm going to cover it, and while I suction, I'm going to rotate it in a circular motion while taking it out. And so then after that, I would make sure that I do not do this for no longer than 10 to 15 seconds because it can cut off my patient's oxygen supply. And after that, I would flush my catheter, and then I would assess the effectiveness of the suctioning, and I would repeat if needed. And then if I remain sterility, I can just redo it again. And then I would also make sure that my patient would be able to tolerate it again if I was to do it again. And then so if I was to do it again, I would make sure I would do a 30-second to 1-minute interval to allow my patient to take a couple deep breaths so they can breathe again. And then after that, I would make sure that if I was to do it again to resuction, to make sure that I do not do it more than 3 times at a time during a suction episode. And then I would also have my patient hyperventilate, cough, or deep breathe before suctioning to help breathe and get some breaths in. And then so after that, I would turn off my suction so I can turn it off, and then I would also reassess my patient's respiratory status. So I would make sure that they were breathing at the same rate they were before, and make sure they're taking some deep breaths. And then after that, I can get rid of this, and then I can take off my gloves. So take off my gloves, and then discard them, but I'm going to keep them just in case for later. And then after that, I would wash my hands. I would make sure that my patient is back in comfy position. I would get rid of the towel, the waterproof pad, and then I would document that I did her trach suctioning. And then